patient didn't look very stable. So after report, I found the doctor. He came in and took a look at the patient, and he immediately was like, we're about to intubate. So we had pharmacy in the room, the medicines, nurses for help. We had everything we needed, everybody that we needed. And the doctor was like, can we get a suction set up? And I looked at the wall and there was no suction set up. So of course, everybody looked at me because I'm the nurse. What are you doing, Jamie? Why don't you have a suction set up in your room? What's up, YouTube? It's me, Jamie K, and today we are going to be talking about 5 things that I've learned in the ER. So obviously I've learned way more than 5 things. However, these 5 things I will never forget because I learned by experience. And you know, that's the best way to learn is by doing something, and you will never forget it because you made the mistake the first time. So it's like, I'm never going to make that mistake again. So these 5 things will be in my head forever. Obviously, there's lots of other things that I've learned that I will never forget, but I just wanted to highlight these 5 so that you won't make the same mistake that I made. I have a couple of story times that go with these, so you will never forget, just like I will never forget. So let's get started. Let's start off with number 1. I've actually heard this tip a couple of times, but I really wanted to make sure I put it in my video as well because I experienced this firsthand. So treat the patient and not the monitor. I'm still a new grad, I'm still in my first year, but this is something that I really will never forget. I could not get the SpO2 monitor on the patient to work. It was not working, it wasn't reading on the monitor. So I go get my preceptor. Can you figure out why this is not working? Okay, she's like, okay, let's try nose probe, let's try ear probe. And those 2 didn't work. So we finally went to go get a forehead probe. Once my foot hit the door to grab the forehead probe, the monitor started going off. And my preceptor was in the room. She was like, Jamie, hit the code blue button. So moral of the story, make sure that you're assessing the patient at the same time while you're assessing the machines, because the machines are very helpful actually. Like we rely on our monitors and our machines quite a lot in the hospital. So those are just as important. However, make sure that you are assessing the patient as well. Another example, the monitors at the nurses stations, like that gives you a visual of the patient without actually having eyes on the patient. The monitor will give you, hey, this patient may need to be checked on. Go physically look at the patient. So sometimes we get alarm fatigue. I looked on a monitor one time and it was VFib. So I was like, let me go check and see. And going in the room, the patient actually was in VFib. So just make sure that you're matching the monitor and the patient, both of those assessments together. Number 2, Reglan and Dexamethasone have immediate side effects if they are pushed too quickly. So obviously some of you nurses already out there already know this, but me, I didn't learn until after I gave the medicine because it freaked me out just as much as it freaked the patient out. I stayed calm, I stayed with the patient, I educated them, even though I didn't know what was going on. So Reglan, number 1, is used, well, they're both used for migraines. Reglan is kind of also used for nausea and vomiting. It increases peristalsis in the gut, so it's also given for nausea and vomiting, but I've mainly given it for migraines. But if you give Reglan too fast, it can kind of make the patient feel kind of antsy, kind of jittery, like kind of anxious and jittery. And then dexamethasone is a steroid that's given as well for migraines and inflammation, obviously. But they can kind of make you feel like you have ants in your pants, and it can make your vaginal or like your genital area, your perineal area feel really itchy and burning. It'll make you feel like that whole area is on fire. I had no idea, so I gave Reglan dexamethasone. I didn't push it. I never pushed my meds, but I gave it just normally, like a slow push, and they still felt that sensation. And I was like, I'm burning down there. And obviously the first thing I'm gonna think of is allergic reaction. But I don't want to leave the patient in the room. So I stayed in there, just calmed him down. It only lasted like 30 seconds. But after I left, I talked to my preceptor and I was like, so this happened. And she's like, oh yeah, that's a side effect, just dilute it and push it slow. So don't forget that. And for the people that don't know, Reglan and Dexamethasone. Dilute and push very slow. Okay, third, we have suction in all the rooms. This is something that actually was taught to me by my preceptor and every other nurse in the ER. They always tell me, always have suction set up in the room. For obvious reasons. Things can go down very quickly and you don't want to be going looking for things when the patient is going down. So a good rule of thumb is like during handoff report, just go ahead and put one in the room. Check and make sure that you have one in the room while you're getting handoff just at the beginning of your shift. And then once you use one, just replace it. So my story time about suction, I was actually at handoff report and I was, the nurse was giving me report on her patients. The patient kind of looked not very, to me, the patient needed to be seen by a doctor as soon as possible. The patient didn't look very stable. So after report, I found the doctor. He came in and took a look at the patient and he immediately was like, we need the RSI kit, we need pharmacy, we're about to intubate. So we had pharmacy in the room, we had the rapid sequence intubation kit, the medicines, nurses for help. We had everything we needed, everybody that we needed. And the doctor was like, can we get a suction set up? And I looked at the wall and there was no suction set up. So of course, everybody looked at me because I'm the nurse. What are you doing, Jamie? Why don't you have a suction set up in your room? So not only was that just like a little embarrassing, but it's just like, you need to be prepared. We're about to take care of this patient. And what if the doctor didn't notice that we had suction and we needed it like immediately? I have to run out of the room and get a suction set up. So like, I really appreciate all the nurses that were telling me like, you need to have this done. You need to make sure you have suction. And that's like a small tip, but it's actually very, very important. Okay, so fourth, so nurses, a little bit of everything. Some of you already know this, but which is okay because you are the nurse. You are the heart of the hospital. Like, it's okay, it comes with the job, but it's just something that I didn't know. Like nurses are more than just passing meds. Nurses do a little bit of registration, a little bit of transportation, a little bit of phlebotomy, a little bit of comfort care, emotional support, psych nursing, OB nursing, palliative care, hospice, oncology. You have ICU patients in the ER sometimes, so you get a little bit of ICU experience. You get a little bit of med-surg experience because you're holding patients for so long in the ER. So that's very important as well. We see a little bit of everything, and that's the reason why I really love the job, because I get to see and do so many things. However, the nurse has a huge responsibility because we are doing all of those things. You can imagine like how the shift would be. You can imagine how busy your shift is because of all the things you are doing. I found myself comforting family members after a loved one has passed, helping out with paperwork, workers' comp. Different patients have different needs. Nurses do a lot of things, and that's what makes ER nurses and nurses in general so special and so talented. Thank you to all the nurses out there. Like, you guys are the jack of all trades. You also have to do a lot of educating. So patients have lots of questions all the time, wanting to know why is the wait so long and what procedure is this and why am I having this procedure? When you're giving medicines or when you're discharging a patient, you have to tell them, don't take this antibiotic with your birth control because it won't be as effective. And even taking any erectile dysfunction meds such as Viagra, because I have to know that before I give you this nitro. Lots and lots of education. Nurses have a big job. And don't worry, don't try to figure out all of this before you come in. You will learn it once you get there, because I learned it all once I got there. I'm telling you to give you a heads up before you do, and you don't make the same mistakes that I did. And last but not least, okay, guys, number 5, and this one is very important because, like I said, something that I learned the hard way, I guess. Please use this and have everything that you need. So scissors, stethoscope. My story time with the stethoscope is I had a patient that came in with left-sided body pains. Heart rate was elevated, weakness, could barely walk, shortness of breath, difficulty breathing, all the things. I know we're so busy, we rarely have time to do like a full-fledged focused assessment with the stethoscope and everything, but it's very important to use it when, you know, we do focused assessment. So if you have somebody that is short of breath, having difficulty breathing, especially with the patient that I had with everything else that she had going on, it's important to just use the stethoscope. It takes like 5 to 10 seconds literally. I actually listened. I was in orientation, so I was listening to everybody. But this patient, I was like, no, I need to listen. But it turns out she had a pneumothorax. Her lung was completely collapsed. And once I was listening to it, she did have diminished sounds on one side than the other. So that's just something that I will never forget. Like, I will never forget that. So that's very important. That's a small assessment that can be so big in diagnosing the patient correctly. And I know I said 5, but I'm gonna add one more because this one is also very important. Prioritize. So obviously they drill prioritization in our head during nursing school. But for me, the example that I have is I had a patient come in, she was an MVC, and she had shoulder pain. So obviously you want to get her taken out of her clothes so we can see if there's anything else injured, and start in an IV so we can get blood work going, give her pain medicine, etc., etc. So for me, I was still in orientation as well, but for me, I didn't prioritize. I don't know why. I didn't prioritize. Once they got there, they put the patient on the bed. My first thing was to put the patient in a gown. Obviously, that's not priority. So I was still in orientation, still learning, but that's not priority. Putting a patient in a gown is not as important as starting an IV access to get blood work and give the patient medicine. And putting the patient on a heart monitor so we can read their heart rhythm, the blood pressure cuff, the O2 monitor, like all of that is so much more important than putting the patient in a gown. My reasoning was that they were an MVC and you want to get them naked to see everything. However, you need an oxygen, you need a blood pressure. It's a mistake, something I will never do again. It's something that you'll never do because I just told you. So priority is very important. Those are my tips for you guys. This was supposed to be a short video, but I really hope that this helps you because for me, I learned a lot very fast. And so those are the 6 things that stuck with me the very most. And I want to tell you so you don't make the same mistakes that I made. I'm an ER nurse, but I'm sure that these tips will also go for other nurses as well. So I hope that this video was helpful for all the nurses, especially the brand new nurses, because I'm still a brand new nurse. I haven't even hit my 1-year mark yet, but I still want to help other brand new nurses that are like week 1 or month 1 or day 1. So I hope this video helps you guys. Please, please, please leave comments, questions, concerns in the comments. I will respond to all of them. And I hope that this video helps reach somebody today. So thank you guys for watching. Please don't forget to like, comment, and subscribe. And toodaloo.